Hey students, this is your Nandini ma'am. Today we are going to read chapter number 8, Arm, from the book B.D. Chaurasia, Human Anatomy, Volume 1. So let's get started. Introduction. The arm extends from the shoulder joint till the elbow joint. The skeleton of the arm is a solo bone, the humerus. Medial and lateral intermuscular septa divide the arm into an anterior or flexor compartment and a posterior or extensor compartment to give each compartment its individuality and freedom of action. Since the structures in the front of arm continue across the elbow joint into the cubital fossa is also included in this chapter. The arm is called brachium, so most of the structures in this chapter are named accordingly, like brachialis, coracobrachialis, and brachial artery. Surface landmarks. The following landmarks can be felt in the living subject. Number 1. The greater tubercle of the humerus is the most lateral bony point in the shoulder region. It can be felt just below the acromion process, deep to the deltoid when the arm is by the side of the trunk. Figure 8.1. Number 2. The shaft of the humerus is felt only indistinctly because it is surrounded by muscles in its upper half. In the lower half, the humerus is covered anteriorly by the biceps brachii and brachialis and posteriorly by the triceps brachii. Number 3. The medial epicondyle of the humerus is a prominent bony projection on the medial side of the elbow. It is best seen and felt in a mid-flexed elbow. Number 4. The lateral epicondyle of the humerus is less prominent than the medial. It can be felt in the upper part of the depression on the posterior lateral aspect of the elbow in the extended position of the forearm. Number 5. The medial and lateral supracondylar ridges are better defined in the lower portions of the medial and lateral borders of the humerus. They can be felt in the lower one-fourth of the arm as upward continuations of the epicondyles. Number 6. The deltoid forms the rounded contour of the shoulder. The apex of the muscle is attached to the deltoid tuberosity located at the middle of the anterior lateral surface of the humerus. Number 7. The coracobrachialis forms an inconspicuous rounded ridge in the upper part of the medial side of the arm. Pulsations of the brachial artery can be felt in the depression behind it. Number 8. The biceps brachii muscle is overlapped above by the pectoralis major and by the deltoid. Below these muscles, the biceps forms a conspicuous elevation on the front of the arm. Upon flexing the elbow, the contracting muscle becomes still more prominent. The tendon of the biceps can be felt in front of the elbow. The tendon is a guide to the brachial artery which lies on its medial side. Number 9. The brachial artery can be felt in front of the elbow joint just medial to the tendon of the biceps brachii. Brachial pulsations are used for recording the blood pressure. Number 10. The ulnar nerve can be rolled by the palpating finger behind the medial epicondyle of the humerus. During leprosy, this nerve becomes thick and enlarged. Number 11. The superficial cubital veins can be made more prominent by applying tight pressure round the arm and then contracting the forearm muscles by clenching and releasing the fist a few times. The cephalic vein runs upwards along the lateral border of the biceps. The basilic vein can be seen along the lower half of the medial border of the biceps. The cephalic and basilic veins are connected together in front of the elbow by the median cubital vein, which runs obliquely upwards and medially. Compartments of the arm. The arm is divided into anterior and posterior compartments by extension of deep fascia, which are called the medial and lateral intermuscular septa. Figure 8.2. These septa provide additional surface for the attachment of muscles. They also form planes along which nerves and blood vessels travel. The septa are well defined only in the lower half of the arm and are attached to the medial and lateral borders and supracondylar ridges of the humerus. The medial septum is pierced by the ulnar nerve and the superior ulnar collateral artery. The lateral septum is pierced by the radial nerve and the radial collateral artery or the anterior descending branch of the profunda brachii artery. Figure 8.7. Two additional septa are present in the anterior compartment of the arm. The transverse septum separates the biceps from the brachialis and encloses the musculocutaneous nerve. The anterior-posterior septum separates the brachialis from the muscles attached to the lateral supracondylar ridge. It encloses the radial nerve and the anterior descending branch of the profunda brachii artery. Anterior compartment. Muscles. Muscles of the anterior compartment of the arm are the coracobrachialis, the biceps brachii, and the brachialis. They are described in tables 8.1 and 8.2. Morphological importance of coracobrachialis. Morphologically, the muscle is very important for the following reasons. The coracobrachialis represents the medial compartment which is so well developed in the thigh. In some animals, it is a tricipital muscle. In human, the upper two heads have fused and musculocutaneous nerve passes between the two and the lowest third head has disappeared. Persistence of the lower head in human is associated with the presence of ligament of Schroeder's, which is a fibrous band extending from the trochlear spine to the medial epicondyle of the humerus, to which the third head of the coracobrachialis is inserted, and from the lower part of which the pronator teres muscle takes origin. Beneath the ligament pass the median nerve or brachial artery, or both. The front or anterior compartment of the arm is homologous with flexor and medial compartments of the thigh. The flexor compartment of thigh lies posteriorly because the lower limb bud rotates medially. Nerves. Musculocutaneous nerve. The musculocutaneous nerve is the main nerve of the front of the arm and continues below the elbow as the lateral cutaneous nerve of the forearm. See figure 7.1a. It is a branch of the lateral cord of the brachial plexus arising at the lower border of the pectoralis minor. See figure 4.14 in the axilla. Table 8.1. Attachments of muscles. The headings are muscle, origin, insertion. Number 1. Coracobrachialis. See figure 2.8. The medial aspect of tip of the coracoid process with the short head of the biceps brachii. Figure 8.3a. The middle 5 cm of the medial border of the humerus. Number 2. Biceps brachii. Figure 8.3b. It has two heads of origin. The short head arises with coracobrachialis from the lateral aspect of tip of the coracoid process. The long head arises from the supraglenoid tubercle of the scapula and from the glenoidal labrum. The tendon is intracapsular. Posterior rough part of the radial tuberosity. The tendon is twisted. The anterior fibers become lateral and posterior fibers become medial. The tendon is separated from the anterior part of the tuberosity by a bursa. Figure 8.4. The tendon gives off an extension called the bicipital aponeurosis, which extends to ulna, and it separates median cubital vein from brachial artery. Number 3. Brachialis. Figure 8.5. Lower half of the front of the humerus, including both the anterior medial and anterior lateral surfaces and the anterior border. Superiorly, the origin embraces the insertion of the deltoid, medial and lateral intermuscular septa, coronoid process and ulnar tuberosity, rough anterior surface of the coronoid process of the ulna. Table 8.2 nerve supply, and actions of muscles. The headings are muscle, nerve supply, and actions. Number 1, coracobrachialis, figure 8.3a. Musculocutaneous nerve C5 to C7 flexes the arm at the shoulder joint. Number 2, biceps brachii, figures 8.3b and C, 8.6, 8.7. Musculocutaneous nerve C5, C6. It is a strong supinator when the forearm is flexed. All screwing movements are done with it. It is a flexor of the elbow. The short head is a flexor of the arm. The long head prevents upwards displacement of the head of the humerus. It can be tested against resistance as shown in figure 8.8. Brachialis, number 3. Musculocutaneous nerve is motor. Radial nerve is proprioceptive. Flexes forearm at the elbow joint. Root value. The root value of musculocutaneous nerve is ventral rami of C5 to C7 segments of spinal cord. Origin, course, and termination. Musculocutaneous nerve arises from the lateral cord of brachial plexus in the lower part of the axilla. It accompanies the third part of the axillary artery. It then enters the front of arm where it pierces coracobrachialis muscle. Musculocutaneous nerve runs downwards and laterally between biceps brachii and brachialis muscles to reach the lateral side of the tendon of biceps brachii. It terminates by continuing as the lateral cutaneous nerve of forearm 2 cm above the bend of the elbow. Figure 8.6. Relations. In the lower part of the axilla, it accompanies the third part of the axillary artery and has the following relations. Anteriorly, pectoralis major. Posteriorly, subscapularis. Medially, axillary artery and lateral root of the median nerve. See figure 4.9. Laterally, coracobrachialis. See figure 4.9. Musculocutaneous nerve leaves the axilla and enters the front of the arm by piercing the coracobrachialis, figure 8.6. In the arm, it runs downward and laterally between the biceps brachii and brachialis to reach the lateral side of the tendon of the biceps. It ends by piercing the fascia 2 cm above the bend of the forearm. Branches and distribution. Muscular branches. It supplies the following muscles of the front of the arm: coracobrachialis, biceps brachii, long and short heads, brachialis, figures 8.6 and 8.7. Cutaneous branches. Through the lateral cutaneous nerve of the forearm, it supplies the skin of the lateral side of the forearm from the elbow to the wrist, including the ball of the thumb. See figure 7.1a. Articular branches. The elbow joint through its branch to the brachialis, the shoulder joint through a separate branch which enters the humerus along with its nutrient artery. Communicating branches. The musculocutaneous nerve through lateral cutaneous nerve of forearm communicates with the neighboring nerves, namely the superficial branch of the radial nerve, the posterior cutaneous nerve of the forearm, and the palmar cutaneous branch of the median nerve. Median nerve. Median nerve is closely related to the brachial artery throughout its course in the arm, figure 8.9. In the upper part, it is lateral to the artery. In the middle of the arm, it crosses the artery from lateral to the medial side and remains on the medial side of the artery right up to the elbow. In the arm, the median nerve gives off a branch to the pronator teres just above the elbow and vascular branches to the brachial artery. An articular branch to the elbow joint arises at the elbow. Ulnar nerve. Ulnar nerve runs on the medial side of the brachial artery up to the level of insertion of the coracobrachialis, where it pierces the medial intermuscular septum and enters the posterior compartment of the arm. It is accompanied by the superior ulnar collateral vessels. At the elbow, it passes behind the medial epicondyle where it can be palpated with a finger. Figure 8.13a. Radial nerve. At the beginning of the brachial artery, the radial nerve lies posterior to the artery. See figure 4.9. Soon the nerve leaves the artery by entering the radial or spiral groove on the back of the arm, where it is accompanied by the profunda brachii artery. Figure 8.13a. In the lower part of the arm, the nerve appears again on the front of the arm, where it lies between the brachialis medially and the brachioradialis and extensor carpi radialis longus laterally. Figure 8.17. Its branches will be discussed with the back of the arm. Dissection. Make an incision in the middle of deep fascia of the upper arm right down up to the elbow joint. Reflect the flaps sideways. The most prominent muscle seen is the biceps brachii. Deep to this, another muscle called brachialis is seen easily. In the facial septum, between the two muscles lies the musculocutaneous nerve, a branch of the lateral cord of brachial plexus. Trace the tendinous long head of biceps arising from the supraglenoid tubercle and the short head arising from the tip of the coracoid process of scapula. Identify coracobrachialis muscle on the medial side of biceps brachii. This muscle is easily identified as it is pierced by musculocutaneous nerve. Clean the branches of the nerves supplying all the three muscles dissected. Clinical anatomy. Physician holds the patient's wrist firmly, not letting it move. Patient is requested to flex the elbow against the resistance offered by physician's hand. One can see and palpate hardening biceps brachii muscle. Figure 8.8. Biceps reflex. Musculocutaneous nerve is tested by biceps reflex. Tap the tendon of biceps with forearm pronated and partially extended at the elbow. Normal reflex is jerk-like flexion of elbow joint. Brachial artery. Features. Brachial artery is the continuation of the axillary artery. It extends from the lower border of the teres major muscle to a point in front of the elbow at the level of the neck of the radius, just medial to the tendon of the biceps brachii. Beginning, course, and termination. Brachial artery begins at the lower border of teres major muscle and as continuous of axillary artery. It runs downwards and laterally in front of arm and crosses the elbow joint. It ends at the level of the neck of radius in the cubital fossa by dividing into its two terminal branches, the radial and ulnar arteries. Relations. Number 1. It runs downwards and laterally from the medial side of the arm to the front of the elbow. Number 2. It is superficial throughout its extent and is accompanied by two venae comitants. Number 3. Anteriorly, in the middle of the arm, it is crossed by the median nerve from the lateral to the medial side. And in front of the elbow, it is covered by the bicipital aponeurosis and the median cubital vein, figure 8.9. Number 4. Posteriorly, it is related to the triceps brachii, the radial nerve, and the profunda brachii artery. Number 5. Medially, in the upper part, it is related to the ulnar nerve and the basilic vein, and the lower part to the median nerve, figures 8.9a and b. Number 6. Laterally, it is attached or related to the coracobrachialis, the biceps brachii, and median nerve in its upper part, and to the tendon of the biceps brachii at the elbow, figures 8.9a and b. Number 7. At the elbow, the structures from the medial to the lateral side are median nerve, brachial artery, biceps brachii tendon, radial nerve on a deeper plane. Branches. Number 1. Unnamed muscular branches. The profunda brachii artery arises just below the teres major and accompanies the radial nerve. This was point number 2. Then number 3. The superior ulnar collateral branch arises in the upper part of the arm and accompanies the ulnar nerve, figures 8.10a and b. Number 4. A nutrient artery is given off to the humerus. Number 5. The inferior ulnar collateral branch or supratrochlear branch arises in the lower part and takes part in the anastomosis around the elbow joint. Number 6. The artery ends by dividing into two terminal branches, the radial and ulnar arteries. Anastomosis around the elbow joint. Anastomosis around the elbow joint link the brachial artery with the upper ends of the radial and ulnar arteries. They supply the ligaments and bones of the joint. The anastomosis can be subdivided into the following parts. In front of the lateral epicondyle of the humerus, the anterior descending, which is radial collateral branch of the profunda brachii anastomosis with the radial recurrent branch of the radial artery. It is recurrent. Figures 8.10a and b. Behind the lateral epicondyle of the humerus, the posterior descending branch of the profunda brachii artery, which is middle collateral anastomosis with the intraosseous recurrent branch of the posterior intraosseous artery. In front of the medial epicondyle of the humerus, the inferior ulnar collateral branch of the brachial artery anastomosis with the anterior ulnar recurrent branch of the ulnar artery. Behind the medial epicondyle of the humerus, the superior ulnar collateral branch of the brachial artery anastomosis with the posterior ulnar recurrent branch of the ulnar artery. Dissection. Dissect the brachial artery as it lies on the medial side of the upper part of the arm, medial to the median nerve and lateral to the ulnar nerve. Figures 8.9a and b. In the lower half of the upper arm, the brachial artery is seen lateral to the median nerve as the nerve crosses the brachial artery from lateral to medial side. Note that the median nerve and brachial artery are forming together a neurovascular bundle. Ulnar nerve, accompanied by the superior ulnar collateral branch of the brachial artery, will be dissected later as it reaches the posterior or extensor compartment of the upper arm by piercing the medial intermuscular septum. Look for the radial nerve on the posterior aspect of artery before it enters the radial groove. Clean the branches of brachial artery and identify other arteries which take part in the arterial anastomosis around the elbow joint. Clinical anatomy. Brachial pulsations are felt or auscultated in front of the elbow just medial to the tendon of biceps for recording the blood pressure. Figure 8.11. Figure 8.12 shows other palpable arteries. Although the brachial artery can be compressed anywhere along its course, it can be compressed most favorably in the middle of the arm where it lies on the tendon of the coracobrachialis. Blood for blood gas analysis is collected from brachial artery. Changes at the level of insertion of coracobrachialis. Number 1. Bone. The circular shaft becomes triangular below this level. Number 2. Facial septa. The medial and lateral intermuscular septa become better defined from this level down. Figure 8.5. Number 3. Muscles. Deltoid and coracobrachialis are inserted at this level. Figure 8.3a. Upper end of origin of brachialis. Upper end of origin of the medial head of triceps brachii. Number 4. Arteries. The brachial artery passes from the medial side of the arm to its anterior aspect. The profunda brachii artery runs in the spiral groove and divides into its anterior descending or radial collateral artery and posterior descending or middle collateral branches. Figure 8.9. The superior ulnar collateral artery originates from the brachial artery and pierces the medial intermuscular septum along with the ulnar nerve. The nutrient artery of the humerus enters the bone. Number 5. Veins. The basilic vein pierces the deep fascia. Figure 8.13b. Two venae comitants of the brachial artery may unite to form one brachial vein. Number 6. Veins. It's nerves. The median nerve crosses the brachial artery from the lateral to the medial side. Figure 8.9. The ulnar nerve pierces the medial intermuscular septum with the superior ulnar collateral artery and goes to the posterior compartment. Figure 8.9. The radial nerve pierces the lateral intermuscular septum with the anterior descending, which is radial collateral branch of the profunda brachii artery and passes from the posterior to the anterior compartment, figure 8.13a. The medial cutaneous nerve of the arm pierces the deep fascia, figure 8.13b. The medial cutaneous nerve of the forearm pierces the deep fascia, figure 8.13b. Cubital fossa. Features. Cubital fossa is a triangular hollow situated on the front of the elbow. It is homologous with the popliteal fossa of the lower limb situated on the back of the knee. Boundaries. Laterally. Medial border of the brachioradialis, figure 8.14. Medially, the lateral border of the pronator teres. Base. It is directed upwards and is represented by an imaginary line joining the front of the two epicondyles of the humerus. Apex. It is directed downwards and is formed by the area where brachioradialis crosses the pronator teres muscle. Roof. The roof of the cubital fossa, figure 8.15, is formed by skin, superficial fascia containing the median cubital vein joining the cephalic and the basilic veins. The lateral cutaneous nerve of the forearm lies along with the cephalic vein and the medial cutaneous nerve of the forearm along with basilic vein. Deep fascia, bicipital aponeurosis. Floor. It is formed by brachialis, figures 8.16a and b, supinator surrounding the upper part of the radius. Contents. The fossa is actually very narrow. The contents described are seen after retracting the boundaries. From medial to lateral side, the contents are as follows. Number 1. The median nerve. It gives branches to flexor carpi radialis, palmaris longus, flexor digitorum superficialis, and leaves the fossa by passing between the two heads of pronator teres, figure 8.18. Number 2. The termination of the brachial artery and the beginning of the radial and ulnar arteries lie in the fossa. The radial artery is smaller and more superficial than the ulnar artery. It gives off the radial recurrent branch. The ulnar artery goes deep to both heads of pronator teres and runs downwards and medially, being separated from the median nerve by the deep head of the pronator teres, figure 8.19. Ulnar artery gives off the anterior ulnar recurrent, the posterior ulnar recurrent, and the common introitious branches, figure 8.10. The common introitious branch divides into the anterior and posterior introitious arteries and latter gives off the introitious recurrent branch. Number 3. The tendon of the biceps brachii, figure 8.17. Number 4. The radial nerve. It descends medial to the lateral epicondyle to enter cubital fossa. In the fossa, it gives off the posterior introitious nerve or deep branch of the radial nerve, which gives branches to extensor capri radialis brevis and supinator. Then it leaves the fossa by piercing the supinator muscle, figure 8.18. The remaining superficial branch runs in the front of forearm for some distance. Dissection. Identify the structures, see text, present in the roof of a shallow cubital fossa located on the front of the elbow. Separate the lateral and medial boundaries formed respectively by the brachioradialis and pronator teres muscles, figures 8.14 and 8.19. Clean the contents. Median nerve on the medial side of brachial artery. Terminal part of brachial artery bifurcating into radial and ulnar arteries. The tendon of biceps brachii muscle between the brachial artery and radial nerve. The radial nerve on a deeper plane on the lateral side of biceps tendon. Identify brachialis and supinator muscles forming the floor of cubital fossa. Clinical anatomy. The cubital region is important for the following reasons. The median cubital vein is often the vein of choice for intravenous injections. See figure 7.8. It is used for introducing cardiac catheters to get sample of blood from various chambers of the heart. The blood pressure is universally recorded by auscultating the brachial artery in front of the elbow, figure 8.11. The anatomy of the cubital fossa is useful while dealing with the fracture around the elbow, like the supracondylar fracture of the humerus. Posterior compartment. Features. The region contains the triceps muscle, the radial nerve, and the profunda brachii artery. The nerve and artery run through the muscle. The ulnar nerve runs through the lower part of this compartment. Triceps brachii muscle. Origin. Triceps brachii muscle arises by the following three heads, figures 8.20a and b. Number 1. The long head arises from the infraglenoid tubercle of the scapula. It is longest of the three heads, figure 8.21. Number 2. The lateral head arises from an oblique ridge on the upper part of the posterior surface of the humerus, corresponding to the lateral lip of the radial or spiral groove, figure 8.20a and b. Number 3. The medial head arises from a large triangular area on the posterior surface of the humerus below the radial groove, as well as from the medial and lateral intramuscular septa. At the level of the radial groove, the medial head is medial to the lateral head. See figures 2.14a and b. Insertion. The long and lateral heads converge and fuse to form a superficial flattened tendon which covers the medial head and are inserted into the posterior part of the superior surface of the olecranon process. Figure 8.20. The medial head is inserted partly into the superficial tendon and partly into the olecranon process. Although the medial head is separated from the capsule of the elbow joint by a small bursa, a few of its fibers are inserted into this part of the capsule. This prevents nipping of the capsule during extension of the arm. These fibers are referred to as the articularis cubitae or the subancunis. Nerve supply. Each head receives a separate branch from the radial nerve C7, C8. The branches arise in the axilla and in the radial groove. Actions. The triceps is a powerful active extensor of the elbow. The long head causes extension and adduction of arm at shoulder joint. It supports the head of the humerus in the abducted position of the arm. Gravity extends the elbow passively. Electromyography has shown that the medial head of the triceps is active in all forms of extension, and the actions of the long and lateral heads are minimal, except when acting against resistance. Dissection. Reflect the skin of back of arm to view the triceps brachii muscle. Define its attachments and separate the long head of the muscle from its lateral head. Radial nerve will be seen passing between the long head of triceps and medial border of the humerus. Note the continuity of radial nerve up to axilla. Carefully cut through the lateral head of triceps to expose radial nerve along with profunda brachii vessels. Note that the radial nerve lies in the radial groove on the back of humerus, passing between the lateral head of triceps above and its medial head below. In the lower part of arm, the radial nerve lies on the front of elbow just lateral to the brachialis, dividing into two terminal branches in the cubital fossa. The ulnar nerve, which was seen in the anterior compartment of arm till its middle, pierces the medial intermuscular septum with its accompanying vessels, reaches the back of elbow, and may easily be palpated on the back of medial epicondyle of humerus. Clinical anatomy. In radial nerve injuries in the arm, the triceps brachii usually escapes complete paralysis because the two nerves supplying it arise in the axilla. Physician holds the flexed forearm firmly. Patient is requested to extend its elbow against the resistance of the physician's hand. The contracting triceps brachii is felt. Figure 8.22. Radial nerve or musculospiral nerve. Radial nerve is the largest branch of the posterior cord of the brachial plexus with a root value of C5 to C8 and T1. See figure 4.14. Origin, course, and termination. Radial nerve is given off from the posterior cord in the lower part of axilla. Number 1, it runs behind third part of axillary artery, see figures 4.7c and D. Number 2, in the arm, it lies behind the brachial artery, figure 8.9a. Number 3, leaves the brachial artery to enter the lower triangular space to reach the oblique radial sulcus on the back of the humerus, figure 8.13a. Number 4, the nerve reaches the lateral side of arm 5 cm below deltoid tuberosity, purses lateral intermuscular septum to enter the anterior compartment of arm on its lateral aspect, figure 8.13a. Number 5, it descends down medial to the lateral epicondyle into the cubital fossa. Radial nerve terminates by dividing into a superficial and a deep branch, posterior interosseous nerve, just below the level of lateral epicondyle. These are seen in the cubital fossa, figure 8.18. Relations. In the lower part of the axilla, the radial nerve passes downwards and has the following relations. Anteriorly, third part of the axillary artery, see figure 4.8. Posteriorly, subscapularis, latissimus dorsi, and teres major. Laterally, axillary nerve and coracobrachialis. Medially, axillary vein, see figure 4.9. In the upper part of the arm, it continues behind the brachial artery and passes posterior-laterally with the profunda brachii vessels through the lower triangular space below the teres major and between the long head of the triceps brachii and the humerus. It then enters the radial groove with the profunda vessels. See figure 6.11. In the radial groove, the nerve runs downwards and laterally between the lateral and medial heads of the triceps brachii in contact with the humerus, figure 8.13a. At the lower end of the groove, 5 cm below the deltoid tuberosity, the nerve pierces the lateral intermuscular septum and passes into the anterior compartment of the arm, figure 8.17, to reach the cubital fossa, where it ends by dividing into superficial and deep branches. Branches and distribution. Various branches of radial nerve are shown in figures 8.23a to c. Muscular. Number 1. Before entering the spiral groove, radial nerve supplies the long and medial heads of the triceps brachii. Number 2. In the spiral groove, it supplies the lateral and medial heads of the triceps brachii and the enconeus. Number 3. Below the radial groove on the front of the arm, it supplies the brachialis with the proprioceptive fibers. The brachioradialis and extensor carpi radialis longus are supplied with motor fibers. Figure 8.23a. Cutaneous branches. Number 1. In the axilla, radial nerve gives off the posterior cutaneous nerve of the arm, which supplies the skin on the back of the arm. Figure 7.1b. Number 2. In the radial groove, the radial nerve gives off the lower lateral cutaneous nerves of the arm and the posterior cutaneous nerve of the forearm. Articular branches. The articular branches near the elbow supply the elbow joint. Clinical anatomy. The radial nerve is very commonly damaged in the region of the radial groove. The common causes of injury are as follows. Sleeping in an armchair with the limb hanging by the side of the chair, Saturday night palsy, or even the pressure of the crutch, which is crutch paralysis, figures 8.24a and b. Fractures of the shaft of the humerus. This results in the weakness and loss of power of extension at the wrist draw, figure 8.25, and sensory loss over a narrow strip on the back of the forearm and on the lateral side of the dorsum of the hand, figure 8.26. Wrist drop is quite disabling because the patient cannot grip any object firmly in the hand without the synergistic action of the extensors. Profunda brachii artery. Profunda brachii artery is a large branch arising just below the teres major. It accompanies the radial nerve through the radial groove, and before piercing the lateral intermuscular septum, it divides into the anterior and posterior descending branches which take part in the anastomosis around the elbow joint. Figure 8.10. Branches. Number 1. The radial collateral or anterior descending artery is one of the terminal branches and represents the continuation of the profunda artery. It accompanies the radial nerve and ends by anastomosing with the radial recurrent artery in front of the lateral epicondyle of the humerus, figure 8.10. Number 2. The medial collateral or posterior descending artery is the largest terminal branch which descends in the substance of the medial head of the triceps. It ends by anastomosing with the introitious recurrent artery behind the lateral epicondyle of the humerus, figure 8.10. It usually gives a branch which accompanies the nerve to the incorneus. Number 3. The deltoid or ascending branch ascends between the long and lateral heads of the triceps and anastomoses with the descending branch of the posterior circumflex humeral artery. Number 4. The nutrient artery to the humerus is often present. It enters the bone in the radial groove just behind the deltoid tuberosity. However, it may be remembered that the main artery to the humerus is a branch of the brachial artery. Facts to remember. Medial root of median nerve crosses the axillary artery in front to join lateral root to form the median nerve. The order of structures from medial to lateral side in the cubital fossa is median nerve, brachial artery, tendon of biceps brachii, and radial nerve. Triceps brachii is the only active extensor of elbow joint. Gravity extends the joint passively. Biceps brachii is a strong supinator of the flexed elbow, besides being its flexor. Clinico-anatomical problem. In a motorcycle accident, there was injury to the middle of back of arm. Which nerve is likely to be injured? What muscles are affected? Name 5 of them. What is the effect of injury? Answer. Due to injury to the middle of back of arm, the radial nerve gets injured. The muscles of arm affected partially are lateral and medial heads of triceps brachii. A part of muscle escapes paralysis as it gets supplied in the axilla. The other muscles affected are the extensors of forearm. These are brachioradialis, extensor carpi radialis longus and brevis, extensor digitorum, and extensor pollicis longus. The effect of injury is wrist drop. So this was chapter 8, arm. Thank you so much.